Bonjour tout le monde. Good morning, everyone. It's a pleasure to be here with all of you today. C'est un énorme plaisir pour nous d'être ici avec vous aujourd'hui. Avant de débuter, j'aimerais prendre un instant pour reconnaître que nous sommes réunis ici à Moncton, sur les terres traditionnelles non cédées des peuples Mi'kmaq et Malicite, un territoire qui est couvert par les traités de paix et d'amitié. I'd also like to take a moment to give a special welcome to my friends and colleagues from New Brunswick that are here today. We have Jenica Atwin, Member of Parliament for Fredericton, Pat Finnegan from Miramichi Grand Lake, Serge Cormier from Acadie Bathurst, and the special people that are here with us from Vitality. I'm especially pleased today to be able to welcome a friend to New Brunswick, our Prime Minister of Canada. Our Prime Minister is certainly no stranger to Atlantic Canada in New Brunswick, as he certainly spent lots of time here, and we appreciate his friendship. And finally, we are here today, and I'm a bit out of breath because I went up some steps, so that's a bad sign. We're really happy to be here today in order to thank some of our frontline service providers that have done exceptional work over the years. We have asked Canadians to stay home for the past year and a half, but we've also asked our healthcare professionals to really leave their home and to go to work, and they have done some incredible work over the past year and a half. So we had an opportunity this morning to meet with them and to say thank you, and for that we are extremely grateful. Just last week, or a few weeks ago, I had an opportunity to get my second shot for my vaccine. And I have to say, the nurse that gave me my shot told me that she had been retired, but came back to work because she wanted to play a role. So it just goes to show the incredible dedication that our healthcare providers have and want to take part in this initiative. So again, thank you. And without further ado, I certainly want to welcome to the podium someone who doesn't need much introduction in the province of New Brunswick. So the Minister responsible for intergovernmental affairs, and also the President of the Queen's Privy Council, and also a key member for the COVID Cabinet Committee, Monsieur Dominique Leblanc. So Dominique, if you want to come up and say a few words, that'd be fantastic.
Merci beaucoup, Ginette, Monsieur le Premier ministre, chers collègues à la Chambre des communes et nos chers représentants de la Régie de santé Vitalité. I'm very pleased to be here, obviously, with my colleagues from the House of Commons representing the province of New Brunswick and with the Prime Minister of Canada. As Ginette said, to have an opportunity to show the Prime Minister the remarkable work done by women and men who have been for many months on the front lines of the fight against COVID, administering vaccines safely and effectively and efficiently to our fellow citizens is a huge opportunity. And Prime Minister, si vous me permettez un mot personnel, je vous ai mentionné ça hier soir, la Régie de santé Vitalité comprend l'hôpital régional Georges L. Dumont. Et il y a 2 ans, quand moi j'étais dans une situation médicale extrêmement difficile. Les médecins, les infirmières, le personnel de l'hôpital Georges Dumont, de la Régie de santé Vitalité, ont littéralement, Monsieur le Premier ministre, sauvé ma vie. Alors vous comprendrez pour moi d'être ici avec ces femmes et ces hommes extraordinaires et tout à fait spécial aussi. And ladies and gentlemen, I had, as Ginette said, the privilege of chairing our government, our cabinet's COVID response committee. And in that function, day after day, I had the privilege also of seeing up close. I had a front row seat to see a remarkable leader and Prime Minister focused on protecting Canadians through COVID-19, but obviously focused on procuring, delivering to provinces the vaccines necessary to bring COVID-19 under control. Week after week, I participated with the Prime Minister in detailed briefings where he asked scientists, logistics experts, and of course, First Ministers and Premiers across the country what the Government of Canada needed to do to get as many vaccines to Canada as quickly as possible to protect Canadians. Et pour moi, c'était un privilège extraordinaire de voir un Premier ministre tellement focusé sur les questions de vaccins, les détails techniques, les détails en termes d'administration de vaccins avec les provinces et les territoires, Et moi, je suis tout à fait fier comme Canadien qu'on avait un leader et un premier ministre extraordinaire en poste pour ces moments si difficiles. Et c'est pourquoi le Canada est chef de file dans le monde actuellement en termes d'administrer des vaccins sécuritaires et efficacement pour protéger notre population. Alors avec ça, Monsieur le Premier ministre, je vous souhaite encore une fois bienvenue à Moncton et je vous donne la parole.
Bonjour à tous. D'abord, merci Dominique pour cette introduction et pour tout ton travail en tant que ministre et leader pour les gens ici au Nouveau-Brunswick. A big shout out as well to our outstanding MP from Moncton, the Honourable Jeanette Petitpas-Taylor, and our whole team that never stops working for people in the province. Great to see you here, Jenica, Pat, Serge. Also want to thank Brigitte and Anne for stepping up as part of the Vitality Health Network. And again, I want to thank you, as I thanked some of the healthcare workers earlier I met with, for having taken such good care of Dominic a couple of years ago. He's been a really important part of our path through this pandemic as chair of the COVID committee and many other things. And it's great to have him at full health. But also want to thank all the incredible health workers who stepped up to make sure that Canadians here in New Brunswick and across the country are kept safe. My friends, it's great to be back here in New Brunswick, and what better place to spend some time than at the Moncton Coliseum? Because if there's any example of New Brunswickers' warmth and sense of community, it's here at the vaccine clinic today. The clinic staff and volunteers, some of whom I met a few moments ago, are doing a remarkable job. They got up to around 3,000 doses a day administered during peak moments, which is incredible. And it means so many more people can worry less and see each other more. We're seeing people continue to come in, lots of people with second doses, but still people stepping up on first doses as well. And the fact that we can continue to get people on that path to safety so we can get through this pandemic and back to full normal lives as quickly as possible is really, really important. So I really want to thank everyone and tell them to keep up the great work. Here at the Coliseum, I also chatted with some folks getting their shots. There's lots of relief at being more protected, lots of excitement, looking forward to hugging family or getting together with friends. I was talking with a young 14-year-old who admitted that not all of his friends are getting vaccinated, so I impressed upon him to encourage them to get out and get their doses as well, because we all want to get back to normal as quickly as possible. We want to be there to protect our loved ones, and we know that getting vaccinated is the way Canada gets through this. That's why we worked around the clock to secure as many doses as possible, and on that front, today, I have some really great news to share. Canada now has enough COVID-19 vaccines delivered to fully vaccinated everyone who's eligible for a shot. That works out to over 66 million doses in total that we've received in Canada. Back in the winter, I made a promise that we would have enough vaccines for all eligible Canadians by the end of September. So not only have we kept that promise, but we've done it 2 months ahead of schedule. Aujourd'hui, je peux vous annoncer que le Canada a maintenant reçu assez de vaccins contre la COVID-19 pour que toutes les personnes admissibles puissent être pleinement vaccinées. Jusqu'à maintenant, on a reçu plus de 66 millions de doses. Et bien entendu, quand plus de gens deviendront admissibles, on s'assurera que les doses seront disponibles pour eux aussi. Cette étape importante nous rappelle tout le chemin parcouru. En quelques mois, on est passé des premières doses aux personnes les plus vulnérables à plus de 80% des Canadiens admissibles qui ont maintenant reçu leur première injection. Le Canada continue d'être en tête du classement mondial. Ici, au Nouveau-Brunswick, durant la fin de semaine, vous avez franchi votre propre étape importante, votre millionième dose administrée. C'est énorme. Et c'est parce qu'on a travaillé ensemble. De notre côté, on va continuer à aider les provinces et les territoires à distribuer les vaccins. I know that here in New Brunswick, mobile vaccine clinics are being set up to make it even easier for people to get their shots. So if you haven't gotten vaccinated yet, make sure that you do. Remember, these vaccines are safe. They've passed Canada's world-class standard for medical approvals. These vaccines work. They're one of the best ways to keep yourself and others safe. Look, what we're seeing right now is that the overwhelming majority of cases in Canada are in people who haven't been fully vaccinated yet. In fact, only 0.5% of cases being recorded are in fully vaccinated people. These vaccines work and they're safe, and they're also available and, of course, completely free. So with enough doses for everyone, there's no more excuses to not get your shot. Do it for yourself, because nobody wants to get sick, and it's the unvaccinated and partially vaccinated who are getting sick right now, to larger numbers. But you can still pass on the virus if you're fully vaccinated. It's just more difficult, and it's keeping you safer. But unvaccinated people are at highest risk right now. And if you're not going to do it for yourself, do it for your loved ones who need to be protected, including from the new variants of concern. Do it for health workers who are out there on the front lines and have been for a very long year and a half, stepping up to keep everyone safe. You don't want to have to put them at risk. We don't want to have to start overwhelming our ICUs and our hospitals again with unvaccinated people getting cases. And do it for kids. Kids under 12 years old aren't yet able to get vaccinated. Hopefully that's going to change soon. And I know the companies are working very hard on making sure that that happens and safely. But as a dad, I find it really difficult to talk to my 7-year-old and explain why he can't get vaccinated when his older brother and sister are being kept safe from this disease. And as we get back to school in the fall, we need to make sure that everyone is as safe as possible to keep our kids safe. It's about stepping up to do the right thing, as Canadians have been doing all throughout this pandemic. And that's been the story, particularly here in New Brunswick, but right across the country, of people pulling together to be there for each other. We can keep it up, and we can continue to lead the world in keeping everyone safe. Le Canada s'est mieux sorti de cette pandémie que presque tous les autres pays du monde. Et c'est parce qu'on a été là les uns pour les autres. On en est à la fin de cette crise, on l'espère. Des meilleurs jours nous attendent, alors continuons tous de travailler ensemble pour arriver. En terminant, je veux me joindre encore une fois à tous les Canadiens pour féliciter nos médaillés olympiques. I will say, as a feminist, it's particularly great to see just how extraordinarily well our women athletes are doing in Tokyo 2020 right now. So keep up the great work. Merci tout le monde. Je suis maintenant content de prendre vos questions.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions qui aura une durée de 20 minutes avec une question de suivi, en commençant avec RDI.
Bonjour, Michel Brideau. Ma question est au sujet donc de ces 66 millions de doses reçues au Canada. Il y a quand même déjà des dizaines de milliers de doses en trop dans certaines provinces. Est-ce qu'il est temps pour votre gouvernement de durcir le ton pour que toutes les doses soient utilisées et que les Canadiens reçoivent toutes leurs doses?
On est en train certainement de regarder des façons de motiver, d'encourager les gens de se faire vacciner. On comprend qu'il y a encore des gens qui hésitent et c'est pour ça qu'on souligne que les vaccins sont non seulement sécuritaires et efficaces, mais c'est la façon qu'on va passer à travers de cette pandémie dans les mois à venir. On voit ce qui se passe avec les variants comme Delta en Europe, où parmi des populations qui sont moins vaccinées ou sous-vaccinées, il y a des éclosions importantes et ça cause beaucoup de problèmes pour l'économie, pour la communauté et aussi pour le système médical. On a la chance maintenant d'accélérer le pas de vaccination, de convaincre les gens qui hésitent jusqu'à ce point-là de se faire vacciner, parce qu'on va le voir dans les mois à venir, les gens qui vont tomber malades, les gens qui vont transmettre le virus aux autres, ça va être des gens non vaccinés. Et vraiment d'encourager tout le monde de le faire le plus rapidement possible, c'est comme ça qu'on va passer à travers.
Et M. Trudeau, on entend ici et là des gens qui sont un peu surpris d'apprendre que Santé Canada propose d'autoriser des traces plus importantes d'insecticides et de fongicides dans les bleuets et les framboises. Qu'en pensez-vous?
Je pense que c'est important de souligner qu'on est en train justement de faire ces consultations pour voir quelle est la perspective, les préoccupations du public. En tant que gouvernement, oui, on se base sur la science pour garder les gens en sécurité, mais on compte aussi écouter les experts, les citoyens qui ont souvent des préoccupations à ce niveau-là, et nous allons prendre les bonnes décisions pour les Canadiens et pour notre milieu agriculturel.
Hi, Shane McGee with CBC. In 2019, you said that you would ensure that the province of New Brunswick funded Clinic 554. So far, you haven't kept that promise. When will you keep that promise?
Making sure that every woman across this country has access to reliable reproductive health and services is extremely important to us, and that is why we have continued to work with partners across the country and to impress strongly upon the Government of New Brunswick how it needs to keep up its obligations under the Canada Health Act. The fact that New Brunswick hasn't yet done that is exactly why we withheld millions of dollars in health transfers to New Brunswick, because they have not lived up to their obligations under the Canada Health Act. That was a decision we took in Budget 2021. We are not giving New Brunswick its full health funding because they continue to make it difficult for women to access the full range of reproductive services. I know Jenica Atwin has been a strong advocate for women's rights and for services for the people of Fredericton. There was an opportunity to visit Clinic 554 last week alongside our Deputy Prime Minister and Finance Minister, Chrystia Freeland, and I can assure you that we continue to be working extremely hard to ensure that everyone across the country has access to the full range of reproductive services, including through Clinic 554 here in New Brunswick.
It's been a month since Crown Indigenous Affairs Minister Carolyn Bennett apologized for a text to Jody Wilson-Raybould, and there was information that came out about a toxic work environment. Do you still have faith in Bennett to continue playing a key role with your cabinet? And the minister also failed to deliver on a promise of a rights and reconciliation framework. So will that change?
The work that Canada has been doing over the past 6 years on reconciliation has been extraordinarily important, not just for Indigenous peoples, but for all Canadians. And Carolyn Bennett has been at the heart of the work around transforming our perspectives on reconciliation, on supporting pathways towards greater self-government, recognition of rights, and she remains an extraordinarily strong and valued voice for reconciliation. But reconciliation can't just be about government and Indigenous peoples. It has to involve all Canadians. As we've seen from the terrible discovery of graves, unmarked graves around residential schools, the work we have to do as a country to both recognize our past and repair our present and build a better future involves all of us. Because people are now understanding that residential schools, in their approach to teach, if you can even use that word, Indigenous kids that they had no worth in their language or their culture. At the same time as residential schools were teaching that to Indigenous children, non-residential schools, other schools across the country were also driven by that philosophy or that perspective, which is totally wrong, but was the perspective many, many decades ago, that there was no value in Indigenous language or culture. And generations of Canadians learned and grew up with that mistaken perspective. So all of us have to do the work of understanding truth, of being part of reconciliation and transforming the relationship, the partnership we have with Indigenous peoples.
Good morning, Prime Minister. Tom Bateman from the Times and Transcript.
Oui, je vais y aller. Je pense que ce qui est important de se souligner, pour la réconciliation, que c'est pas juste une question de la relation entre un gouvernement et les peuples autochtones, ça implique toutes les personnes au Canada, autochtones et non autochtones. Parce que pendant que les écoles résidentielles étaient en train d'enseigner aux jeunes autochtones et d'imposer aux jeunes autochtones une dévalorisation de leur culture, de leur identité, de leur langue, dans toutes les autres écoles au pays, c'était ce même message de dévalorisation, de marginalisation, de manque de respect pour les peuples autochtones dans ce pays. Alors oui, on est en train de reconnaître les dégâts, les dommages, les tragédies autour des pensionnats autochtones, mais il faut aussi reconnaître que cette même mentalité était présente dans toutes les écoles du Canada et donc nous avons tous des choses à réapprendre. Nous avons tous l'obligation de regarder nos institutions qui ont été créées avec cette réflexion en tête, en bien des cas, pour les transformer, pas juste pour reconnaître les erreurs du passé, mais pour réparer les conséquences de ces erreurs dans le présent et surtout pour bâtir un avenir meilleur aussi.
Sorry about that. Yesterday, we saw Quebec offer a third dose of vaccine to some of its citizens who want to travel internationally. Previously, some of the Atlantic provinces reported the wastage of several thousand doses of vaccine. And this is coming as many countries are desperate to receive any vaccine they can. Do you think either the provincial or the federal government or both bear some responsibility for the inefficiencies in our own system?
I think when we're talking about a massive vaccination campaign like we've seen in Canada, where frontline health workers, provinces, the federal government have all worked together along with volunteers and community members across the country, you have to recognize that we have done extraordinarily well. We're at the top of the world in terms of vaccination processes. But there's always more to do. And one of the things that I'm emphasizing for people is that Health Canada approval processes are widely respected as being amongst the best in the world. We are one of those touchstone agencies that people look to see if a product or a process is safe. And the fact that Health Canada is recognizing the vaccines that are most safe and effective for Canadians is something that we are making sure people understand around the world. We will continue to work with our international partners to recognize that Health Canada processes are outstanding and anyone who is considered fully vaccinated in Canada is safe to travel around the world. Je pense que nous devons souligner à quel point Santé Canada est une agence extrêmement respectée à travers le monde pour l'excellence de son travail. C'est une des agences qui est une référence pour bien des pays qui n'ont pas la même qualité de processus ou de science qu'on a ici. Pardon. La même qualité de processus et de science qui a été fait ici au Canada. Donc, quand Santé Canada approuve un traitement, une vaccination comme étant sécuritaire et efficace, le monde peut savoir qu'on a bien fait notre travail. On est en train de travailler avec les partenaires à travers le monde pour souligner à quel point les différentes façons que les Canadiens se sont fait vacciner ont tous comme résultat que les Canadiens pleinement vaccinés selon les définitions de Santé Canada devraient être accueillis partout dans le monde comme étant pleinement vaccinés.
It seems to me like by the end of the day, we'll have another maritime province with a progressive conservative premier signing on to a childcare deal with your government. Do you think that the New Brunswick provincial government is delaying a similar negotiation because of the looming prospect of an election that is yours to call?
I think it's really, really important that through this pandemic, people understand where the challenges and the faults are in our system. And one of the things that I think everyone understood as so many people were forced to work from home and have their kids at home across the country, that it is time to move forward with a serious, universal, national child care program across this country. But of course, that is something that we need to work out with the provinces. So the federal government has put up billions of dollars to partner with the provinces to get to very clear outcomes. Cut in half the costs of childcare over the next year and get to $10 a day childcare within 5 years. At the same time, make sure that we're putting an emphasis on public sector and nonprofit sector spaces while continuing with some private sector spaces. And at the same time, making sure that early childhood educators get properly paid. These are the things that we are putting out there as the bars that need to be hit before we partner with the provinces on this. And I'm very happy to say that British Columbia, Nova Scotia, and the Yukon have all moved forward with childcare agreements. And as you hinted at, there will hopefully be a lot more announcements in the coming days. But I can assure you that we continue to work with all provinces who understand how important it is to move forward on childcare, and we are very hopeful that people will understand that this is something that is not just a social program, but also an economic and jobs program. And that's why we are optimistic in our discussions with all provinces that we're going to be able to move forward soon. But the ball is very much in the provinces' courts. We have agreements with a number of provinces. They know what the terms are. We're going to be firm on our outcomes, that it be a top quality, affordable system across the country. And we look forward to provinces agreeing with us and signing on as soon as they can, because the women and families in New Brunswick and indeed across the country deserve affordable quality childcare.
Thank you, Mr. Prime Minister. Eilish with CTV News. So can you confirm then that this subsidy program was in fact offered to New Brunswick, but sounds like it may have been rejected thus far?
We have been working on childcare with the provinces, including with bilateral agreements that stretch back to 2017, because as a government, as a Liberal federal government, we've understood that investing in childcare is good for families, it's a good social program, but it's also a good economic program. Well, what has happened in this pandemic is suddenly the business community across the country, and a lot of people who were hesitant on the value of childcare, have been convinced of what we and childcare activists and feminists have long known, that childcare is an essential program to grow our economy, to support families, and to give kids, all kids, the best opportunity through their schoolings. So we are engaged in discussions with all provinces. Some provinces that are more like-minded have moved extremely quickly. Obviously, BC, Nova Scotia, and Yukon Territory were very happy to move forward quickly. There hopefully will be more in the coming days. I'm not going to make any announcements early. We will announce them when we announce them. I will say that a lot of provinces are engaged in discussions, including New Brunswick with us, and we are hopeful that we're going to be able to get to the right outcomes. But the ball is very much in their court as to what our approach is. We've laid it out: $10 a day within 5 years, half price by next year, support for educators, an emphasis on public sector and nonprofit spaces. These are the things that a number of provinces have signed on to. These are the building blocks of a truly national childcare campaign, national childcare program. And I'm very hopeful that all provinces will end up signing on in the coming months. But it'll take, in some cases, pressure from local activists, unions, family groups to say, look, the federal government has billions of dollars for childcare across the country. We want our share. You better sign on soon.
So why exactly do you believe it hasn't been given the green light here in New Brunswick, but as well as those other provinces who haven't signed on yet? And is it disappointing to see that there is that hesitation? There
are 8 provinces that haven't yet signed on to childcare as of 11 o'clock this morning. So we will keep working to get there. This is an issue where the federal government doesn't have direct jurisdiction. Childcare is very much a provincial area of jurisdiction, as Quebec demonstrated 25 years ago when they created an extraordinary and effective childcare model that has not only helped families, but helped grow the economy and get women into the workforce. So the federal government can't simply wave a magic wand and create national child care across the country, no matter how many billions of dollars we put towards it. We need to work with the provinces to make sure they actually deliver the quality child care that women and families across the country deserve. So we are happy to work with the provinces. We've set the terms, we've set our expectations, and various provinces are going through their own processes on determining exactly how that works for them, what fits for them. But the model is there, and we encourage all provinces to sign on as soon as possible to give families and women and businesses an opportunity to flourish under strong childcare.
Hi there, Travis Fortnum from Global News. This weekend, the Montreal Canadiens made the decision to draft a player who was charged with distributing non-consensual intimate images of a young woman in Sweden last year. They did this despite the player asking not to be drafted and despite the fact that he was charged with doing this that it's a criminal offense here in Canada. As a Montreal MP, wondering if you're disappointed with this decision and what message you think it sends to young male athletes in Canada.
As a lifelong Habs fan, I have to say I am deeply disappointed by the decision. I think it was a lack of judgment by the Canadiens organization. I think they have a lot of explaining to do to Montrealers and to fans from right across the country. En tant que fan fini du Canadien, il faut que j'avoue que j'ai été très déçu de la décision. Je pense que ça a été une erreur de jugement. Je pense que le club a des explications à offrir aux Montréalais et aux fans à travers le pays.
BC is recording a big surge in COVID-19 cases among people who have chosen not to get vaccinated. Wondering if you believe putting restrictions on the unvaccinated could incentivize some holdouts to get the shot, and do you believe it would be fair for Canadians who have gotten vaccinated to be locked down again if there's a fall spike in cases among the unvaccinated?
I think, unfortunately, the reality is that with the Delta variant and other variants of concern out there, it is likely that we will see a rise in cases over the coming months. But it will primarily be limited to unvaccinated people. And certainly the serious health outcomes, the overwhelming of our health authorities in certain parts of the country, which is potentially possible, is of real concern. But at the same time, so many millions of Canadians have stepped up and done the right thing and gotten vaccinated for themselves, for the community's safety. It's the way we're going to move forward. And we are working with provinces on creating ways to continue to encourage all Canadians to get vaccinated, as it is safe and as it is effective. I mean, if people are at the point where they're saying, okay, I'm going to let everyone else get vaccinated and then I'll be kept safe. Well, if everyone else gets vaccinated, they will be kept safe. You will not be safe. That's why we need to continue to make sure that people are getting vaccinated. And I know different provinces are looking at incentive programs. We're certainly working with the provinces on documentation to facilitate international travel, as more and more countries, like Canada has just done, is going to open only to fully vaccinated travelers. These are the kinds of things that mean, if that's going to be the reality in the fall, it just makes sense for people to get vaccinated now so that they're protected in the fall.
Sarah Derry, Radio-Canada. En français, maintenant, vous en avez parlé un peu. Vous avez signé l'entente avec Ian Rankin en Nouvelle-Écosse sur la question du programme fédéral des garderies $10. Blenix, ici, semble être un peu partagé sur la question. Où en sont les discussions présentement?
Les discussions sont en cours avec le Nouveau-Brunswick, comme ils le sont avec des provinces à travers le pays. On a vu non seulement la Nouvelle-Écosse, mais la Colombie-Britannique et le Yukon signer. On a, j'espère, d'autres annonces à venir. Et la réalité, c'est que différentes provinces sont en train de regarder leurs priorités. On a été très, très clair en termes des priorités du gouvernement fédéral. On a des centaines de millions, des milliards de dollars à investir dans les garderies à travers le pays pour des provinces qui acceptent les les paramètres de ce qu'on a à offrir aux familles, c'est-à-dire 10 $ par jour d'ici 5 ans. On coupe en deux les coûts d'ici 1 an. On s'assure qu'on va bien payer les travailleurs, les travailleuses dans le système de garderie et de petite enfance. Et aussi, on met l'emphase sur le secteur public et OSBL. C'est nos attentes. On a très clairement dit ça, entre autres, au gouvernement du Nouveau-Brunswick. Et on est en train de négocier actuellement. Et j'espère qu'on va arriver bientôt à des ententes à travers le pays où des femmes dans chaque province, les familles dans chaque province, les enfants dans chaque province vont avoir des garderies de qualité pour aider leur famille et leur communauté.
Et justement, vous allez rencontrer le premier ministre Dennis King à l'île du Prince-Édouard cet après-midi dans un centre scolaire. Est-ce qu'on peut s'attendre à une annonce sous peu sur la question?
On verra bien, mais je suis très content de voir que au-delà de l'allégeance politique, on peut s'entendre. Je pense que c'est quelque chose qu'on a fait et qu'on a vu à travers la pandémie, que l'équipe Canada, les différents premiers ministres de différentes formations politiques ont pu travailler ensemble pour garder les Canadiens en sécurité. Et quand vient le temps de rebâtir en mieux, les gens s'attendent à ce qu'on continue de travailler ensemble.
Prime Minister, a recent Public Health Agency of Canada report found that 90% of COVID-19 cases are among those who are unvaccinated, something you referred to earlier. What is your government doing to persuade Canadians who are vaccine hesitant to get the shot and avoid the situation unfolding in the United States with the Delta variant?
Well, I think, first of all, people who are hesitant about getting a vaccine need to know that the consequences of getting COVID when you are unvaccinated are potentially extraordinarily severe. We know that the severe consequences of COVID, hospitalizations, and the worst outcomes will increasingly be almost entirely in unvaccinated individuals and pockets of the population. I know everyone across the country is sick and tired of COVID-19, sick and tired of the restrictions that they have to go through, sick and tired of having to be careful and cautious when we just want to be with friends and be out there. Well, the best way to get back to normal quickly is to get vaccinated. And we're going to continue with ad campaigns. We're going to continue with provinces putting forward various incentive measures. We're looking at ensuring international vaccine credentials so people who are fully vaccinated can travel around the world. These are the things that people who are still hesitant are going to be missing out on, while at the same time they are putting themselves and their loved ones at risk of serious implications of this disease. Je pense que tout le monde est d'accord qu'on veut en finir avec la COVID-19. On veut passer à travers, on veut être de l'autre côté dans une vie qui retourne à la normale. La réalité, c'est que ça va commencer à se passer plus rapidement pour ceux qui se font vacciner, et ceux qui sont non vaccinés ou pas complètement vaccinés vont être en train d'être à plus grand risque de tomber malade et d'avoir des conséquences sévères. Alors, je sais que tout le monde veut en finir avec les restrictions, avec les limites, de ne pas pouvoir faire les choses comme on faisait avant. Bien, ça va arriver beaucoup plus rapidement pour les gens vaccinés. Et ceux qui sont non vaccinés, je les encourage fortement de se faire vacciner. Il y a des gens qui se disent « Ah, si tous les autres se font vacciner, moi, je n'ai pas besoin de me faire vacciner. » Ce n'est pas la réalité. Si tous les autres se font vacciner, ceux qui ne se font pas vacciner vont être presque les seuls à tomber malades et avoir des conséquences sévères de la COVID-19. Et c'est pas ça qu'on veut, et c'est pas ça que nos travailleuses et travailleurs dans le système de santé veulent non plus. On veut en finir avec les urgences, on veut en finir avec les gens en état critique. Pour ça, tout le monde doit se faire vacciner.
With the Delta variant running rampant in the United States, did Canada jump the gun on reopening its border to vaccinated U.S. travelers as of August 9th?
The health data is fairly clear that encouraging or allowing for travel of fully vaccinated individuals is low risk. It's not zero risk, but it is low risk. And we are confident that, particularly because cases continue to stay low in Canada, that it is the right step to do. But every step of the way, we've proceeded in a gradual, responsible way, and we'll continue to monitor very, very closely new cases, cases that arrive at the border, and we will make decisions in consequence. Nobody wants to go backwards, which is why continuing to get vaccinated is so important for all Canadians, but we will take the decisions necessary to keep Canadians safe, first and foremost, as we have throughout this pandemic.
Thank you, Prime Minister. This is what ends today's press conference.
Merci beaucoup tout le monde. Thank you very much.
Hi everybody. Bonjour à tous. Merci d'être avec nous aujourd'hui. It's really nice to have everybody in Milton. Welcome to Milton. If you're from Milton, you work in Milton, then it's thank you for being such a warm host, as we always are. And if you're not from Milton, thank you for joining us today. My name is Adam Van Couverden, and I'm the Member of Parliament for Milton. And I'm very proud that everybody's joined us today on the traditional territory of the Haudenosaunee, the Huron-Wendat, the Ottawa-Darin, the Anishinaabe, and most recently the Mississaugas of the Credit First Nation. And as always, we are very glad to be sharing this land together. I'm so delighted that this event is happening here in Milton. Communities across the country have pitched in to support each other, to be there for one another, to provide their expertise in the fight against COVID-19, and that's absolutely true here in Milton as well. I want to take just a moment, a personal opportunity to thank everybody here that played such a phenomenal role over the past year and a half in the fight against COVID-19, locally, across the country, and truly across the world. The Olympics are going on right now, and that's the world I come from. And the world that I come from really relies on teamwork. And there's so many people behind the scenes. And, you know, in that context, whether you're doing massages, helping with mental health preparations, you know, filling up water bottles, carrying boats and bikes, it really is all hands on deck. And it has been in Canada and across the world for the last year and a half. So from the bottom of my heart, from the bottom of all of our hearts, thank you. Merci beaucoup, miigwech. Joining us here today in Milton are the Honourable Anita Anand, Minister of Public Services and Procurement, the Honourable Patty Haidu, Minister of Health, Mr. Guy Payette, President of Innomar Strategies, and we also have with us Fabien Paquette of Pfizer Canada, Patricia Gauthier of Moderna Canada, Jane Chung and Franz Dubé of AstraZeneca, and Denis Fredette of FedEx Express Canada. Aujourd'hui, le gouvernement du Canada annoncera une étape importante dans la réponse du Canada face à la pandémie de COVID-19. It's my pleasure to first welcome the Honourable Anita Anand, Minister, President of the world as far as I'm concerned, Minister of Public Services and Procurement, to make this special announcement. Madam President.
It's just so wonderful to be here. Thank you so much, Adam, and thanks to all of you for taking the time out of your busy day to come to Milton, to Innomar, to share this special moment with us. I want to begin today by marking this milestone and thanking you for being here and for playing your part, as Adam mentioned, in the fight against COVID-19. Throughout this pandemic, we have rightly thanked our frontline healthcare workers. Through the first wave, through the second wave, through the third wave and beyond, now with vaccinations occurring across the country, we have been so grateful, and we will continue to be so grateful for the efforts that our frontline healthcare workers are making. Today, I would like to thank, with immense gratitude, another set of Canadians who have stepped up, and that's all of you here today and Canadians in the back rooms who are making sure that we are able to get vaccines into this country out to the provinces and territories so that they can be administered in vaccination centers across this country. Aujourd'hui, je tiens à remercier tout particulièrement les personnes qui travaillent dans les coulisses, y compris les nombreuses personnes ici présentes d'Innomar, de FedEx, car vous vous êtes mobilisés et avez relevé cet immense défi logistique. Thank you to Denis and Lisa from the FedEx team, as well as all of your teams, and Guy and the Innomar team, many of whom are here today, for your role in Canada's vaccine procurement effort. Now, to make sure that we could see Canada through to the other side of the pandemic, our government built a diverse portfolio of vaccines by entering into contracts with 7 vaccine manufacturers last summer. The strategy was first and foremost to put the contracts in place. But following the confirmation of contractual negotiations, we had to continue to press our suppliers to provide vaccines to Canada as early as possible. And so our strategy was one of negotiation and negotiation and negotiation even after those contracts were put into place. Between December 2020 and March 31st, 2021, we were able to exceed our target of 6 million vaccines by 3.5 million doses, so that we ended the first quarter with 9.5 million vaccines in this country. Then again, in the second quarter of this year, we targeted receiving 48 to 50 million vaccines in this country, and again, we closed out June with more than 50 million vaccines in this country. Our overall goal was to ensure that all eligible Canadians would have access to vaccines prior to the end of September. And I am delighted to be here today to mark the arrival of more than 66 million vaccines in this country. And prior to the end of this week, we will see 68 million vaccines in Canada on home turf. This again surpasses our timeline by 2 months. And I would like to not only mark this milestone with you here today, but to thank you for the work that you have each done to make sure that we could get to this spot. Nous avions dit que notre objectif était de disposer de suffisamment de doses d'ici la fin du mois de septembre pour vacciner complètement tous les Canadiens admissibles qui ont choisi de se faire vacciner. Et je suis ravie d'être ici aujourd'hui pour marquer l'arrivée de plus de 66 millions de doses de vaccins contre le COVID-19 au Canada. And as the Prime Minister said earlier today, this major milestone means that we have now received enough doses to fully vaccinate every eligible person in this country. Et grâce à l'effort exceptionnel de toutes les personnes investies dans cette entreprise, nous atteignons cette étape avec 2 bons mois d'avance de notre objectif initial. Cette étape n'a pas été franchie par hasard, mais grâce au travail acharné de nombreuses personnes, tant au sein du gouvernement qu'à l'extérieur et dans toutes les régions de notre pays. It is really thanks to the efforts of so many people that we are here today. This did not happen by accident. It happened by hard work, cooperation, collaboration within and outside government. This has truly been a Team Canada effort. As Minister, I could not be more grateful. And I would like to acknowledge the work that my colleague Minister Haidu and I have done throughout the past year and a half together, day in and day out, working together as a team. It's been a privilege to work with you, Patty. Thank you so much. Now, our strategy, as I mentioned, was to secure a diverse portfolio of vaccines, which, with apologies, I have spoken about very frequently. We did that on the advice of the Vaccine Task Force, and we assembled in Canada a supply of Pfizer-BioNTech, Moderna, and AstraZeneca, the first 3 vaccines that were authorized by Health Canada. And we pressed our suppliers repeatedly to provide as many doses as early as possible. And I want to here acknowledge our suppliers, and in particular recognize Fabien from Pfizer, Patricia from Moderna, France and Jane from AstraZeneca for joining us here today. I lost count long ago how many times we had video calls and we exchanged texts and emails, and our teams were in touch. I mean, really, the number of times is innumerable. And so I'll just say here, thank you so much for your partnership. Thank you for listening to us when we were pressing the need for vaccines in Canada day after day, night after night, week after week, month after month. We are here because of a collective effort, and we appreciate your advocacy within your organizations on behalf of Canada to ensure that we could reach this milestone of 68 million doses in this country prior to the end of July. Thank you so much. I am very grateful. And because of our collective work, to date, more than 80% of eligible Canadians have received at least 1 dose of vaccine, and 64% are fully vaccinated. We are and have been at the top of the world for weeks in terms of the share of the population that has received a single dose of vaccine. And now Canada is at the top of the G20 in terms of the percentage of our population that is fully vaccinated. Ça, c'est incroyable. Et ça, c'est à cause du travail très, très fort de tous les Canadiens et Canadiennes. Après des mois de séparation, nous sommes nombreux à approuver la joie réelle de pouvoir renouer en personne avec les membres de sa famille, les amis, les voisins, les collègues. Le travail n'est pas encore entièrement terminé. We have more work to do. We have more work to do so that we can return to life that we knew it. We are on track, but we need to continue to ensure that Canadians across this country are being vaccinated. And I'm here today to tell you that the supply of vaccines is here. We have enough supply. Let us now continue to get shots in arms as quickly as possible. Et merci beaucoup, ça suffit pour moi aujourd'hui. Let's keep going. Team Canada, miigwech. Thank you.
Merci, Ministre Anand. Everybody was doing the math in their head as we heard 68 million, and that's indeed enough to vaccinate our entire country, which is fantastic news. And as I said previously, that just could not have happened without the extraordinary team effort. We're so fortunate to have amazing leadership throughout this pandemic, and we've all depended on weekly, sometimes daily updates from Minister Haidu, and it's really, really our sincere privilege and pleasure to have you in Milton, have you back in Milton because you've been here before. Thank you for keeping us updated, for all of the work that you've done. Now, please join me in welcoming the Honourable Patty Haidu, Minister of Health.
Well, thank you. I found myself getting emotional listening to Anita speak. I hope I can call you Anita in this esteemed audience, but it's been a journey, hasn't it? And I look at our incredible manufacturers and suppliers and the Team Canada people in front of us, and let me tell you, we are so grateful. We are so grateful because, in fact, many of you will have been obviously participating and listening to the conversation in early January and February where Canadians were scared. And, in fact, your efforts to come through for this country have given Canadians a great deal of comfort and peace and knowledge that, that indeed we can get things done when we work together. And that's exactly what I have done with my colleague Anita day in and day out, as she's mentioned, often in the dreaded Zoom room, but nonetheless, those many, many conversations. It's wonderful to be here in Milton with Adam and Jennifer O'Connell, my incredible parliamentary secretary, who also, believe it or not, we've met many times prior to the pandemic, but was appointed as my parliamentary secretary during the pandemic. It's the first time I'm seeing her since, and I can't tell you how grateful I am for her efforts and work to help assist on this incredible, I think, privilege to serve Canadians. I'm from Thunder Bay, Ontario. It's the homeland of the Anishinaabe of the Robinson Superior Treaty Area, and I'm always so grateful to be able to say that. I live on the beautiful shores of Lake Superior, and I have seen in my own community and certainly all across Canada how Canadians have stepped up over the last year and a half to take care of each other. Aren't you proud to be a Canadian when you look at the efforts of our communities and the people in them to help each other, to make sure that we stay safe, often at great sacrifice to themselves. Small businesses closing for months on end, not knowing if they'll be able to open again or make it through financially. Of course, with the support of a federal government that believed we needed to keep as many businesses and people intact, there was some relief. But nonetheless, that anxiety of not knowing what the future holds, and yet day after day getting up and helping each other. Businesses and community groups feeding each other, reaching out to the vulnerable, housing people, working together to help protect each other and prevent the spread of COVID-19. I am so proud to be a Canadian every single day, but during this pandemic, I can tell you as a health minister, watching what Canadians did for each other, of course the frontline workers, but everyday citizens getting up every day and asking themselves, how can I help? What an incredible country we have. It's been a hard year, yes, but there have been all these moments of joy, actually, in helping each other, in knowing that we're making a difference, and being able to serve differently. You know, when I ran for office, I never thought that I would be a health minister in the middle of a global pandemic. I bet you, as suppliers and logistics folks, never thought that you would be doing something that critical to your country, that critical and that time sensitive and that urgent. And yet, here we all have had this incredible opportunity to serve our fellow Canadians, our country, and indeed the world for some of you. So we have to continue going because now, as Minister Anand points out, we have enough for everyone. That conversation is solved, but we also have to make sure that everyone gets vaccinated as quickly as possible. And so the work continues. We have to ensure that people have the support to get vaccinated, that people have the information they need to get vaccinated, and that we support community groups who are continuing to do that hard work of stepping up to talk to each other in each other's comfort place, their language, their culture. And so at Health Canada and Public Health Agency of Canada, we continue to support people through, for example, the Immunization Innovation Challenge that is around making sure that community groups have the money they need to have those important conversations so that everybody feels safe and comfortable getting vaccinated. We want everybody to be safe, to be sure, and to help be part of that important work of stopping the spread. So that in the fall, when kids go back to school, something they've been missing tremendously here in the province of Ontario, there are as many of us protecting each other as possible so that our children are safe, so that our elderly are safe, so the vulnerable people in our communities are safe. And so the Prime Minister's announcement today, Minister Anand's announcement today, is a key ingredient in this. And the work that all of you have done to get this precious, precious tool to Canadians is incredible. But we have to keep going. And we have to continue to get people immunized. And we also have to continue to protect each other. And that's why, as much as I think we're all tired of public health measures that include smaller gatherings and wearing masks and doing those kinds of things that remind us of the pandemic and the sacrifices we've made, we need to continue till we get the job done. And I know Canadians will. So I want to thank you all. I want to remind Canadians that the best way that we can protect the people we love, including our children and the many small business owners and our families and all of those workers out there fighting so hard for all of us, is to get vaccinated. Thank you very much again for your incredible efforts. We will not forget them.
Thank you, Minister Haidu. As we're all kind of reopening, getting back to normal a little bit, we're all shaking off the nerves. This is my first time at a public podium in a year, and my hands are sweaty and I'm nervous, and we're all nervous about, interacting again. And in my haste, relying on my notes too much, I failed to welcome my friend and colleague, Jen O'Connell, to Milton. Wonderful Parliamentary Secretary to Health. MC 101, folks, I seem to have failed. But it is just so cool to have you both here and to listen to how much teamwork went into the last year. We know there's so much work behind the scenes and there's still so much work ahead of us. So thank you, Minister Haidu, and thank you to the staff and all of the teams who are here as well. Last but certainly not least, I'd like to now invite Mr. Guy Payette, President of Innomar Strategies, to say a few words. Over to you, Guy.
Wow. Quelle belle journée, quel beau moment inoubliable. What a tremendous day and a moment not to forget in our Canadian history. So I'd like to start off by thanking Adam and for his very kind remarks and also for being our Member of Parliament here in Milton. I'd also like to thank the Honourable Anita Anand, the Honourable Patty Haidu, and for selecting our Innomar Strategies Distribution Centre as the location for today's exciting event. I'd also like to extend a warm welcome to Parliamentary Secretary of Health Jennifer O'Connell. So, thank you. And our partners at FedEx Express Canada, Pfizer, AstraZeneca, and Moderna. We are honored to have you all here today. In our facility, which has served as the heart of the logistics effort and where our teams have been working to ensure COVID-19 vaccines are distributed from coast to coast all across this beautiful country. This is a monumental milestone for our country and a proud time for Innomar Strategies as we continue to support access for these critical vaccines. When I started this company 20 years ago, around my kitchen table in Burlington, Ontario, I didn't imagine that we would be part of the government effort to keep Canadians safe. We were laser focused on putting the patient at the center of everything that we did, and we still are today. 20 years later, our focus has paid off. We built our organization, including this warehouse, and this wonderful team here in Milton that has worked tirelessly around the clock to meet the needs of patients and Canadians. And for our role in the vaccine distribution, our focus was on all Canadians. While the scale and the unique temperature control requirements for the COVID-19 vaccines added challenges to the logistics operation, our team was prepared for this moment. This is what we do every day. We are experts in handling the storage of delicate specialty pharmaceutical products, especially those requiring cold chain capabilities. Nous sommes toujours préparés et nous sommes des experts dans la chaîne frigorifique pour la distribution des produits spécialisés en pharmaceutique. Since late December, our teams in collaboration with FedEx Canada have supported the distribution of millions of COVID-19 vaccines to provinces and territories across the country. Constant communication across the supply chain is critical to the success of this distribution effort. We continue to work closely with all our partners to support everyone so that we are prepared for every shipment. Together, we truly created a unique and efficient end-to-end distribution solution for these vaccines. Throughout this global pandemic, our teams have shown tremendous dedication, resilience, and passion as we work through accelerated timelines to ensure that every vaccine that entered our facility was also leaving our distribution center within 24 to 48 hours. Thank you to the NMR and FedEx team. For without them, this would not have been possible. And thank you to our healthcare workers on the front lines. Your service saves countless lives and makes a difference every day. We are honored to continue to work with the Government of Canada, our manufacturer partners, and FedEx to ensure that our family, friends, neighbors, colleagues, and patients can continue to receive timely access to these critical vaccines. So I would just like to close by thanking everyone today. J'aimerais simplement remercier tout le monde. I'm so grateful for all the dedication and hard work that all the staff here in Milton, our entire team, all the staff and team at FedEx. We've formed a powerhouse to assist and play a role in meeting the end of helping to conclude and get us to a place where we're starting to be able to go outside and enjoy and get back to normal. So, merci beaucoup, and c'est tout pour moi.
Merci, Monsieur Payette, et merci pour votre travail, le travail de votre équipe ici. From day one, Canadians and people around the world have relied on science and expertise and innovation and efficiency, and that is emblematic of where we are standing today, and that's because of your vision and your team's hard work, so I can't thank you enough for that. It's nice that Canadians can take it for granted, that they can show up to an appointment, get a free, effective, safe vaccine, and that's really relied on your supply chain and your ability to deploy millions and millions of vaccines. So thank you again. Can't say it enough. As a double vaccinated Canadian who's just so thrilled that both of his parents are too, merci, merci, merci. This ends the announcement portion of the event, and we are ready to start the media availability. So now I would like to invite James Fitzmaurice, Director of Communications for Minister Anand, to moderate the 20-minute question period. James, à vous.
Thank you very much. As Alex pointed out, we have about 20 minutes for questions. We'll start with questions from the phone, come back to the room. Time allowing, we'll go back to the phones. Please keep your questions to one question, one follow-up, please. Nous procédons maintenant aux périodes de questions. Nous avons environ 20 minutes pour ça. On commencera au téléphone. S'il vous plaît, une question, une suivi. Et over to you, the operator. Thank you. Operator, can you go to the first question, please? Operator, can you hear us now? We're ready for questions.
Perfect, thank you, merci. Please press star 1 at this time if you have a question. C'est appuyé sur l'étoile 1 maintenant pour poser une question. Our first question, la première question, Bethany Levitt, the Toronto Star. Your line is open. À vous la parole.
Hi, it's Bethany Levitt from the Toronto Star. Thanks for taking our question. I wondered if anyone among you is in a position, perhaps the folks from Pfizer and Moderna, to talk about the next frontier on vaccines, which is kids, and when we can expect to see approvals for children under the age of 12 to receive a vaccine. And then further to that, Minister Anand, our supply of vaccines for that population and where that stands.
Good morning. My name is Fabien Paquet from Pfizer. I'll answer the question related to the current process. We have studies ongoing on the age group that you've defined, so the below 12 years of age. We are planning to complete the phase 1 and phase 2. Phase 2 and phase 3 studies are starting right now for the 5 to 11 years old, and hopefully we'll get some results by the end of this year and be able to submit to Health Canada for their authorization. So that's what we have right now. More data is going to come eventually. The process is going very well with our clinical trials, and hopefully we'll get some results published later on at the end of the summer, early fall.
Thank you for the question. So Patricia Gauthier from Moderna. We are conducting the Kids Cove study for the age of 6 months to 11 years of age. We are conducting a age de-escalation, dose de-escalation study. So it's taking a bit of time to make sure that we have the right data, and we'll be submitting to Health Canada once we have the data available later in the year. So quite similar to what Fabien just explained. We are currently in the process, and the good news is that the Kids Cove study will have sites here in Canada, so there will be Canadian children included in the study as well. Thank you.
And on the subject of supply, we have supply. That's the bottom line. We have sufficient supply of mRNA vaccines for additional age groups as they begin to receive approval from Health Canada. In particular, we have procured in total 51 million doses of Pfizer, 44 million doses of Moderna. We will receive 95 million doses of both of those vaccine manufacturers prior to the end of September. We are working with our suppliers now on the precise timeline for delivery of the remainder of the vaccines that are still left to come in the country, but let's be clear, at the current time, with the 68 million doses arriving before the end of this week, we have enough supply for all eligible Canadians, and the remainder for additional needs that our country has, including additional age groups or boosters if the science deems that that is appropriate. In addition, we have not only been planning for the short term, we've also been planning for the long term. We signed a contract with Pfizer for the supply of 65 million vaccines from that organization once Health Canada approval has been obtained for the years 2022, 2023, and options on 2024. So the bottom line in response to the question is we have enough supply. Canadians should not be concerned about supply of vaccine for additional age groups or additional shots as they may be needed. Thank you.
Debbie, you have a follow-up?
Yeah, I do, Minister Nance, I don't walk away from the podium too fast. I wonder, as we're seeing, of course, a rise in variants of concern and, the discussion of a fourth wave coming. At the outset of the pandemic, it was a day-to-day scramble for PPE and other supplies, like into the Wild West, I believe, at one point. What's your assessment of how prepared we are now in terms of the supplies and equipment we might need come a fourth wave?
Okay, thanks for your question. What I have been doing on PPE, rapid tests, and vaccines is to make sure that we have sufficient supply in the short and the long term. So, in particular, your question related to PPE, what we did in the first wave of the pandemic was to put into place long-term contracts for the provision of PPE. So we procured 2.7 billion items of PPE. Over 1.5 billion items have been received over a range of categories, surgical masks, N95 respirators, gloves, gowns, you name it, we have it. And we have so much PPE that we have actually procured additional warehouse space. We're working very closely with Minister Haidu and her team and the Public Health Agency of Canada to ensure that we are getting PPE out to the provinces whenever needed. But the bottom line from a supply standpoint is that on PPE also, we are in a very, very strong position. And I will say that at the same time as we were putting into place those long-term contracts for the provision of PPE over the first, second, and third waves, and now into the fourth if that is required, we also focused on building up domestic capacity. And so over 40% of our contracts by dollar value are with Canadian manufacturers of PPE. Last year at this time, we did not produce N95 respirators in this country. As a result of the work at PSPC and with our counterparts at PHAC and Health, we worked very closely with Canadian manufacturers, and indeed ISED led these negotiations. We were able to put into place a contract with Medicom for the provision of N95 respirators, as well as 3M, the retooling of their Brockville plant, and the work that was done between our government and the Ontario government with 3M to ensure the production of 3M N95 respirators here in Canada further prepares us for any additional waves that COVID-19 or any other pandemic may throw at us. We will never again be in the situation where we need to rely on outside jurisdictions for the provision of PPE. Thank you.
Next question, please, operator.
Thank you. Merci. Our next question, Maxime Huon, Radio-Canada. Your line is open. À vous la parole.
Oui, bonjour. Ma question est pour la ministre Annan. Considérant qu'on reçoit assez de doses pour tous les Canadiens éligibles, est-ce qu'il est temps de parler, de se donner des lignes directrices là, sur la 3e dose ou même de considérer de donner davantage de doses à d'autres pays?
Comme j'ai déjà dit, nous avons suffisamment de doses de vaccins pour tous les Canadiens et Canadiens ici maintenant. Et si les provinces, comme la province de Québec, a décidé d'offrir plusieurs de doses, nous avons les doses pour les Canada. Et ça, c'est une priorité pour notre gouvernement, pour la ministre Haidu et moi, était d'avoir des doses pour les Canadiens, Canadiennes. Ça, c'est la première priorité pour notre gouvernement. Donc, ce n'était un problème, ce n'est pas un problème maintenant. Nous avons des doses pour notre pays.
Est-ce que vous avez un suivi?
Oui. Donc, peut-être que vous ne m'avez pas entendu par rapport aux autres pays. Là, je veux juste savoir si on considérait en donner davantage aux autres pays et est-ce qu'on doit craindre du gaspillage de doses si l'engouement pour la vaccination s'essouffle, sachant qu'on a beaucoup de doses, est-ce qu'on doit s'inquiéter qu'il va y avoir du gaspillage?
Je m'excuse. Est-ce que la question est qu'est-ce que nous devons faire pour les autres pays aussi? Oui. Nous avons deux voies. La première voie est d'avoir les vaccins pour les Canadiens et Canadiennes. La deuxième voie est d'aider les autres pays aussi. Donc, nous avons déjà donné plus de 30 millions de doses pour les autres pays. Et récemment, la ministre Gould et moi, nous avons annoncé 17,7 millions de doses d'AstraZeneca pour le COVAX, et ça, c'est les doses pour les autres pays. Donc, c'est deux voies. Nous devons avoir les doses pour les Canadiens, Canadiennes, et aussi en même temps avoir les doses pour les autres pays. Ça, c'est une priorité pour notre gouvernement aussi, et nous allons continuer d'assister les autres pays en même temps d'avoir les vaccins ici au Canada. Merci.
question. La prochaine question, Crystal Oag, Global News. Your line is open. À vous la parole.
Hi there. Thank you for taking my question. My question will be for Minister Haidu. So some premiers have said they won't make COVID-19 vaccines mandatory. Millions of Canadians have yet to get a single dose because of hesitancy. What is the government's plan to curb hesitancy, and are further restrictions for the unvaccinated on the table?
Well, thank you very much for the question. And today's announcement is about enabling provinces and territories to do their job in getting every Canadian possible vaccinated. And we've been there for provinces and territories to help them fulfill their responsibilities in healthcare, whether it is, as my colleague was talking about in the early days, procuring millions and millions of items of PPE, paying for and procuring the vaccines, all the hard work with the manufacturers to make sure that Canadians had access to these vaccines, and we'll continue to be there for provinces and territories to get the job done. At Health Canada and the Public Health Agency of Canada, we continue to work on national media campaigns, as well as a $64 million fund that's being disseminated now to a variety of different community-based organizations that are working in culturally appropriate ways and languages that people understand to help reduce anxiety and fears of people who may not have received that first dose. And let me just tell you about two that I visited in Manitoba last week. One called Women of Color, a group run by Canadian Chinese women that specifically works with other women who speak Mandarin primarily to help them understand the benefits of vaccination, the safety of vaccination, and how it's going to protect their communities. A second, Mamaway Indigenous Health Center, again, working with the Indigenous and urban communities in downtown Winnipeg, providing not just support to understand vaccination, but support for families that are struggling to get access to the center itself. Incredible work is happening out there by Canadians for Canadians, and my job as the Federal Minister of Health is to help amplify that work, whether it's at the provincial level or at the community level. We'll continue to do that till we get the job done.
And do you have a follow-up?
I do, thank you. This is for both Minister Haidu and Minister Anand. So today you both said that Canada has enough vaccines for everyone who is eligible, which is 2 months ahead of schedule. Now that supply is an issue, are you worried Canada will not meet vaccination targets as more and more people are hesitant to getting vaccinated?
Well, I think it's Patty Heidi speaking. I think for me, my response is, first of all, we've exceeded, as we said, the initial targets that we had. We are now months ahead of our target of having enough vaccines so that every eligible Canadian can have access to vaccination. We're leading the G7 and G20, both in first doses and in second doses, and we'll continue to do that work. In my mind, you know, what I would like to see is as many Canadians vaccinated as possible, because of course we know that this is the way Canadians can be safe about their own safety and to protect their families and communities. Listen, our children, as you heard from the manufacturers, are not able to get vaccinated yet. And we know that they are getting sick with COVID-19 here in Canada and around the world. And my worry as a Canadian health minister is that if we head into the fall and we have too many people that are unvaccinated, it gives the virus an opportunity to infect the people we love. It puts the risk of our recovery, it makes the risk so much more elevated. I last week spoke to so many small businesses in my own hometown of Thunder Bay, Ontario, in the downtown Port Arthur core. Let me tell you, those young entrepreneurs have made it through a very difficult time, and there's so much enthusiasm and optimism. And these are our neighbors that are counting on us to get the job done. So yes, of course, I'm going to stay focused as the health minister to make sure that we can support every player, every immunizer, every province and territory, every community group to make sure we get the word out that this is how we protect each other.
So you asked in the question about our worries, and my worry for the past year and a half was to make sure that we have enough PPE, rapid tests, and vaccines in this country as the Public Health Agency of Canada, led by, extremely diligent public servants, as well as Minister Haidu and her team, requested on behalf of the provinces and territories who are seeking to provide these items to Canadians. So my worry is to continue to bring in supply of product that we need. That's my role as procurement minister and the fantastic team that I lead at PSPC. And we will continue to support Minister Haidu and the Public Health Agency of Canada with whatever they need to procure. And one thing that doesn't get mentioned very often is supplies to ensure vaccinations can occur, the swabs, the low dead volume syringes, the needles, the alcohol swabs, the sharps containers. So those are additional items, the fridges, that we will continue to procure. And we'll make sure that we're supplying Canadians and provinces and territories with whatever they need to roll out their vaccine programs or to protect their frontline healthcare workers. And we will continue to support the developing world as well with any supplies that we can. And that's the role that I'll continue to play. Thank you.
Thank you. We'll now take some questions from the room, please.
Hi there, Sean Lee Thong with CTV News Toronto. This is for the Health Minister. Is the federal government considering a certificate of vaccination for citizens that would be accepted anywhere they go?
Well, thank you for the question. And as you know, those are decisions that are being made at the provincial and municipal level, and sometimes at the individual business level. In fact, some organizations have decided, for example, some colleges and universities, that students need to be vaccinated or have a plan to get vaccinated before they can return to class. At the federal level, as you know, we are working with provinces and territories to standardize some proof of vaccination for international travel that may be required by other countries who are looking for proof of vaccination. But the decisions on whether or not there should be vaccine mandatory certificates, those really do rest with provinces, territories, and indeed local public health agencies, as well as in some cases individual organizations.
As a follow-up, up until recently, airports had been separating people based on vaccination status, and then that changed very recently. Why the decision to change?
Well, I can't actually speak to the decisions about the international airports' operational decisions. I will just say this, though. As you know, we have been adjusting measures at the border reflecting vaccination status. And I assume that the many operators that are responsible for orderly transition through the variety of arrival halls are making decisions based on efficiency and on health principles.
As Health Minister, do you weigh in on that?
No, I have not been consulted on, I believe you're talking about the Toronto International Airport. But we will obviously work with any partner. And so Public Health Agency of Canada has worked with a variety of partners. In fact, we have what's called the Rapid Response Team that has continually evolved to provide support to a variety of different stakeholders. For example, it seems like a lifetime ago, but you may remember the Windsor-Essex outbreak as it related to agricultural farms. The Public Health Agency of Canada had a number of experts on the ground, in the fields, working with farmers, working with workers to make sure that we could strengthen processes and protocols. Our agency continues to offer that support at every level.
Thank you very much. That concludes the question period.
Ministers, Parliamentary Secretary, officials, members of the media, thank you so much for coming to Milton. This concludes today's event and announcement. I can't thank you enough for joining us here for this important day. Merci et bonne journée à tous. Au revoir.